when I came on as the workforce director and I looked at the narrative, I was newly hired onto the grant, and I saw all the different positions, all the different programs that we were supposed to implement through the PHIG grant. What I caught was there was a need for more visibility around public health in New York State. Lessons learned from COVID as well, in terms of getting the word out around PPE, places to get vaccines. We recognized that there was a need to make public health public. So that became kind of the running theme behind all of the work of the Public Health Infrastructure Grant in New York State. So internally, we recognized that one of our websites that was supposed to be drawing folks to Public Health Works was the website that was supposed to be drawing folks to understand all the different ways that you can connect to public health, as especially those that are students and wanting to connect and find opportunities to work in the public health department. We revised that website. The website was a little outdated, and we took some time to really think about students and those who might be looking for a career in public health now. What they be looking for? What information do they need? And also, how do we streamline all the different ways that you can connect to employment in public health? So that's one of our internal examples. Externally, another big thing that we did was we took advantage of going to the New York State Fair and educating the public on not only careers in public health, but what is public health and what does it mean? So, students and families had a chance to not only look at careers, but they got to touch and feel and get a sense of like what public health is all about. We had selfie stations. We had our commissioner came out and also got to play around in the station as well. But we were trying to, continue, I guess, with taking our streamlined approaches that we did with the website, but then also bringing them out into the community as well. When working on our approaches to increasing our recruitment strategies, some of the things that we did, so I just mentioned the state fair, but we've also tabled at the APHA, or American Public Health Association conference as well. And one of the things that we were able to do with our human resource team is to be able to look at where are we sourcing our applicants following this recruitment strategy that we did. Our HR department, normally, if we have a balance of internal and external candidates, and usually that's all that you see. But once it hits a certain number for our HR team, they start to also look at that. So over 100 applicants is usually probably their threshold that they start to give us other sources. And APHA is one of our new sources, as well as public health careers, because since we're using those new platforms or we're going out in the community ourselves and educating folks on careers, now we have different ways that we can see where are we really getting our applicants from. To improve the health and well-being of all of New York State, it takes all walks of life to be a part of that. I think that, by being able to go out in the community, talk to different people about public health careers, as well as just public health services in general, that's opened up their eyes to see what public health is all about, and see themselves in different careers in public health as well. Without PHIG funding, we are not able to effectively support the back end of the public health department. We've been able to do incredible things with the funding to be able to really streamline approaches, close up gaps, improve processes, because we're not the ones that are necessarily delivering the 10 essentials. We're behind, we're the back operations, and we're the bench, and we're able to bring in a variety of different resources because of the funding, whether it's training and development opportunities, whether it's a project management team to work through a process directly with teams. But without these funding opportunities, or without this funding source, the efficiency of the public health departments going into 2.0 and 3.0 won't be the same without these funding sources. So we need to continue public health infrastructure funding.